Hello, my name is John. I'm a freshman nursing student. I became a nurse because I wanted to help people during their time of need.
Hello, my name is Mandy. I am also a freshman nursing student. I am not really interested in people, but I am fascinated by what goes on in the ER, love knowing about diseases, and think that I can understand all the machinery in a hospital. I've also seen every episode of ER on the TV, and I love all the uniforms. One day I hope I will marry a doctor. Then I will give up my job. I hate all those early starts and late finishes, and the money is no good anyway.
I'm not really interested in diseases, nor the so-called glamour of the ER. I would like to work with people in a hospice, or with those who are in long-term care, so that I can establish a good relationship with them, perhaps even become their friend.
Oh dear. I like the path class best, and pharm, and all the anatomy and physiology. And the clinical lab work. Let's face it, on the floor, we are so busy, doing paperwork, responding to all the doctor's needs, and administering medication, and telling other people what to do, that we don't have any time to actually talk to patients and their relatives. Who would want to anyway?
Me. Talking is what nursing is all about. We don't need to study all those things, just leave it to the doctors. I liked my nursing theory class best, although I was cynical at first. I learned that nursing was not about curing disease, rather it was all about communicating with people at their time of need. I learned that nursing had at least 4 components or areas of knowledge that Carper called empirical knowing, personal knowing, aesthetic knowing, and ethical knowing.
Oh, that is just silly ivory tower stuff. Those professors, they don't know anything about real nursing. They just think that what we should do is hold hands with the patients and use aromatherapy, all those esoteric things. What does Betty Newman or Callista Roy know about real nursing? Nothing. That's what. Nothing. Diddly squat. All these complicated words that mean nothing, they have nothing to do with nursing.
I don't agree. Florence Nightingale got it right over 150 years ago when she said that the role of the nurse was to put the patient in the best possible environment for nature to act upon him.
What good is that when a patient is in cardiac arrest?
That's not a valid argument.
Yes, it is. Why talk to somebody when they are having a physical crisis?
Doctors should be doing all the physical work associated with a cardiac arrest. As nurses, we should make sure that the patient is comfortable and is kept informed. We should be a reassuring presence.
And what about that crazy purple woman? What was her name?
Do you mean Martha Rogers?
Yes, that crazy purple woman. What did she know about nursing? She's just a 1970s throwback. All that pan-dimensional footy, integrality, and resonancy, what on earth is that?
Martha was a pioneer who moved nursing into a new dimension. Without Martha and her groundbreaking work, The Science of Unitary Human Beings, it is possible that we would not have the work of Jean Watson, Rosemary Parsi, and Margaret Newman.
Who? Who are those people? I've never heard of them.
These people are the new paradigm theorists who simply sat down and wrote about their considerable nursing experience, creating their own definitions of what nursing should be.
Oh, I know what nursing should be. It's taking vitals, and giving out meds and wearing my scrubs, and having fun with the doctors.
Well, if that is what you believe, I'm never going to be able to change that. But I'm sad that you will never be able to understand the real potential and healing power of nursing.
Here is the dilemma. I've described non-vocational medical model nursing.
And I've described patient-centered nursing theory-based nursing.
Which approach do you think is right?
Yes, which approach do you think is right?
Goodbye from me.
And goodbye from me as well.